Hello, folks, and welcome to another exciting episode of West Bloomfield 911. My name is Officer David W. McNealy III, and this is my partner,
Officer Zena Dailey.
Folks, we've got some really exciting guests for you today. We have Cathy Yunker, and we also have Christina Nicholas, and they both work for Oakland County Community Mental Health. Guys, welcome to the show.
Thank you very much.
Do me a favor, stay with us for a moment while I flip the show over to Z for her Daily on the Daily.
Hello, folks, and welcome to Daily on the Daily. We're going to start with Ask a Cop a Question. This question came from Tracy in West Bloomfield. Why do I see police officers drive through intersections without sirens on, or fast without lights and or sirens on? I'll give you two things to start with. The Michigan Motor Vehicle Code 247.603, as well as our department policy, govern the way we drive. So they gave us permission in certain situations that we can actually drive that way. Sometimes we're trying to go somewhere silently so that we can, let's, for example, if someone's breaking into cars in a neighborhood at night, we want to get there silently so they don't know we're coming and they don't take off. So now we're in search of neighborhood, through the neighborhood, in the backyards. We can hopefully catch them in the act and get them right then and there. So those are some of the reasons why we actually do that. Thank you, Tracy. Appreciate the question. The rest of you, like us on Facebook and ask us a question, throw it on there, and I'll try to get you on here as well. Today we're going to talk about drinking and drowning. We have a lot of lakes in West Bloomfield and surrounding our township. So we want to be very mindful of what we're doing when we're out on the water, whether it's a boat or just out swimming. Alcohol lulls our sense of security. We become more adventurous. And what happens once you started drinking, the heat in your body starts to dissipate first from your arms, your legs, and your muscles. So what happens, and this is actually why when people do actually drown, they go down silently, and a lot of people around them don't know what's happening. They're trying to catch their breath. They're trying to use all their energy to try to tread water and try to get up. The problem is they lose their sense of direction as well in the water. So the alcohol really messes with your head. You don't know which way is up anymore, and the current also has a lot to do with that. So when someone goes for a dive and you wait a couple minutes before you realize they haven't come up, it's because they can no longer use their arms and legs anymore. The heat's all gone, so those don't work. Something I want you guys to keep in mind as well if you're boating or you're driving the boat is the threshold for that is 0.08, which is the same as driving on the road with alcohol in your system. Be very mindful of that. And if you're going to be on the boat as a passenger, make sure you and the driver are both wearing your life jackets. It's very important. The effects of alcohol, no one can beat that once you're in the water. Your body's going to do what it's going to do, and you're not going to be able to have control over that. So when we see young adults, usually at night we'll get calls that people are at the lakes, and we have to be very, you guys want to be very careful when you're getting in the water. All right? And that's a wrap. Dave, back to you.
Thank you. That's some really, really good stuff, especially with, spring fast approaching.
Yes.
Good information, so thanks for that.
Thank you.
Guys, stay with us for a minute. We're going to take a short station break, and we'll be right back with you folks.
You're watching West Bloomfield 911 on Civic Center TV, a service of the Greater West Bloomfield Cable Communications Commission. For more information or to watch episodes on demand, visit civiccentertv.com/WB911. Civic Center TV, television that's close to home.
After the tragic loss of an officer in the line of duty, Michigan Concerns of Police Survivors provide support to surviving law enforcement families and co-workers. To learn more about My Cops and upcoming events, or for information on how you can help, visit micops.org or call 877-464-2677.
Folks, welcome back to West Bloomfield 911. I'm Officer David McNealy.
And I'm Officer Zena Dailey.
Folks, we're excited to have these two guests on from the Community Mental Health. Christina and Cathy, welcome back to the show.
Thank you.
Thank you.
Cathy, why don't you start us off today and tell our viewers what exactly does your organization do?
Sure. Oakland County Community Mental Health Authority, it's our formal name, is the entity that manages all of the public mental health services that are available to Oakland County residents. We provide services for adults, for children, individuals who may have a developmental disability, individuals who are in need of a great deal of support because of their mental health issues or their ability to function in the community. We also do a lot of interaction and collaboration with many of the other public servants, including the law enforcement officers in our community, as well as working with schools, hospitals, the other people-caring organizations in the county.
And Christina?
So I also work for Oakland County Community Mental Health Authority, and we are the substance use disorder prevention and treatment arm of the behavioral health services. So we are the public safety net for individuals who need treatment, and also our prevention services really are open to anyone in Oakland County.
Are you guys both social workers?
I am.
I am a social worker as well.
Mm-hmm.
So, Christina, you mainly are in the substance disorder area of it. So what does that entail? What do you see?
So our prevention services really are just that. They are services that are geared towards youth to hopefully prevent the onset of a substance use disorder. They're very family and youth oriented. I know you've had the Alliance of Coalitions for Healthy Communities on this show before. That is one of our providers that we fund all of their services for. So they work primarily with youth. We have we have 8 other prevention providers that we fund that are working throughout Oakland County. And again, our prevention services are really open to any Oakland County resident. And through the Alliance of Coalitions for Healthy Communities, we have 17 community coalitions. West Bloomfield has its own community coalition that is a very good community coalition. All of them are. And really, I said, again, geared towards youth in hopes that they do not develop a substance use disorder. On our treatment end of things, we provide the access to care for individuals who have Medicaid or Healthy Michigan or are underinsured. So if their insurance policy doesn't fully cover substance use disorder services, we can assist, or people who have no insurance at all. And that really entails individual, group, therapy, early intervention services, residential treatment, withdrawal management, or what some people refer to as detoxification from certain substances. And again, with that as well, case management services and a service called Peer Recovery Coach Services, which really those are individuals in long-term recovery from substance use who really have lived experience and can provide support to an individual that's early in their recovery.
So do you guys have a lot of access with the hospitals? How do you get linked up with you guys? How does a person make contact?
Certainly. So through our Access Center, which is really access to all services for children, for adults with mental illness, for individuals with intellectual and developmental disabilities, and individuals with substance use services, we work directly with the hospitals there. So if someone enters into a hospital in need of substance use services, we have a protocol that we use with our hospitals. They contact us. And what we try to do is before discharge, coordinate all of the services. So literally our residential providers can pick someone up from the hospital and transport them directly to the residential facility.
Wow.
You know, I've taken a tour of the actual facility, and you guys on your lower level, I believe, have a area where people can actually stay there when they're recovering. Is that from substance abuse, or is that another part of what you guys do?
That's Cathy.
I think you're referring to our Resource and Crisis Center. Located there are some of our services, including our access team, but the primary services for the public there are delivered through Common Ground. Common Ground operates the crisis unit that is really where law enforcement will bring individuals.
We have a lot of contact with them. They're really fantastic over there. They're really a great resource for us. So you guys are affiliated with them. You fund them.
Right. They are within our network of providers, and they are our sole crisis service provider. And having that
Cathy, when you say crisis, what kind of a crisis? If it goes to a drug addiction, a mental health issue, you guys cover a whole range of things. So what kind of crises do you guys touch on?
We see coming in the front door can be anyone. Generally, though, that crisis unit is for individuals who are experiencing a mental health crisis and are not able to really take care of their own safety or their own treatment at that point.
So you're not having someone come in that's having a financial crisis
Well, they might be, but no, it's intended to really deliver services for people who need to access mental health services.
Okay.
So Common Ground will do that crisis intervention, but then if the individual really does need, let's say, inpatient treatment in a psychiatric setting, Common Ground is able to determine that and then arrange for admission to one of our local hospitals.
So staff there can make that determination
Yes.
for an evaluation to
Correct.
to make it something long term.
And how many doctors do you guys have on staff?
There's generally there's one physician on any given shift, but the team is made up of the psychiatrist, there's nurses on staff, clinical social workers, as well as a really important role played by the peers that also work in that crisis center. There's tremendous value in having people that have been there speak to folks about engaging in treatment and not being as fearful of what might be occurring.
And is there any kind of time frame from this assistance? Once they get into the program and you've been helping them and they've been using your resources, do you guys set a time frame that you can only use it for so amount of time? Is this always accessible to them?
Crisis services are part of the public safety net, so that is always open to the community. If the person is eligible for longer term services, they will get people kind of connected to those services then. So you may be very familiar with some of our other providers, Easter Seals, Community Network Services, Oakland Family Services. So they're able to then help people connect to those longer term services. Usually then that involves a case manager, ongoing psychiatrist, therapies, whatever is needed to manage their
Christina,
mental
I think it
health.
was you that was discussing earlier, a little bit earlier on, if there was a financial situation where they can't afford.
So the substance use funding is fairly unique right now, and we have some specific federal and state funding that really allows us to help the underinsured. There were some cuts to the mental health funding within the last few years that does not allow as much flexibility, but it does for substance use right now, and that is true. And this is both for mental health and substance use, if you call either our crisis line, which as Cathy said, is a public safety net. Anyone can call that. You don't need to be eligible for anything. But if you call our access center, the goal there is, even if you're not eligible for our services, is that it's very important that our staff connect them to what resources they can. Within our Resource and Crisis Center, we also have what is called the RISE Center, and that's called Recovery, Information, Support, and Education. And that center is manned by a peer recovery coach and a case manager. So anyone in the community, you do not have to be an open in our system, anyone in the community can access that 5 days a week from 8:30 to 5. You can call, you can come in. It's at our Resource and Crisis Center, as I said, and there is a case manager or peer recovery coach that's there to
Is there a phone
help
number?
you
Is there a
access.
phone number for that?
Yeah, I knew you were going to ask that, and I do not have that on me at this point. If you contact our access center, you will be able to be linked to the RISE Center. People simply just need to ask. And
We could probably find it on the website too, right?
Yes, at www.occmha.org.
Okay.
It has everything related to our treatment,
Okay.
crisis services. The RISE Center is on there. It's very easy to navigate. Within there, there's also a unique thing that we have, which is called My Strength. And you can access an app, or it can be on your computer. My Strength, which is really a health club for your mind, is the way that they describe it, and it has all sorts of services that you can do yourself related to mental health, substance use, tracking your moods, daily inspirations, and right there it also lists how to access services. But that is open to any Oakland County resident as well, and really assists people with, feeling good about themselves, dealing with depression, anxiety, the daily stresses of life. If you're new to recovery or you're thinking perhaps my substance use may be an issue, you can really engage in this computer program or app, and it will kind of help you determine and link where you need to go. It's completely anonymous, so if you're on it, there is no statistics kept. No one will know who accesses it, and it's completely free to the Oakland County community.
And now the RISE Center, do they also help with people that are looking to get government assistance? Do they help them get in contact with someone or fill out paperwork? So
It's
that could be
about
difficult.
the number one thing that she
Okay.
does. We track all of our case manager. We track all of the services that they provide and what the person came in for, not names or anything, but just what
Yeah.
the person came in for. And the number one thing is helping people apply for benefits.
Yeah, because look, it could be confusing. Any government paperwork that you get, trying to figure out what you need to write down, it could be complicated. So.
It tends to
Yeah.
be difficult to navigate. And our case manager, Alyssa, in the RISE Center is unbelievable with navigating the system, helping people apply for food benefits, for insurance, housing, etc. It's really a great resource, and I highly recommend if people have questions or concerns that they utilize it.
So what do you guys do? I know you guys get people when they're in crisis. Do you guys have any programs out there prior to a awareness type of situation before they get to crisis? As they're like I'm a team trained, so I will go into schools and talk to the youth about different topics and substance abuse and alcohol abuse, things like that. Do you guys have programs like that also that you fan out throughout Oakland County?
Well, as I mentioned, all of our prevention services are all throughout Oakland County. The coalitions really provide a great deal of services, as do our other prevention providers. And it's all about rather than
Right.
assisting someone
Right, before
once
they get
they
to
fully are
crisis.
engaged in the substance use disorder. So that's why it's primarily geared towards youth and families, because we're really trying to mitigate it before it even begins.
And we have multiple grants, which we're very grateful for, because it gives us an opportunity to do things that get us ahead of that crisis curve. So we have a number of grants right now. Project Aware would be one of them, that gets us into the schools, helps people who are working with kids really identify things early on. So obviously, the sooner that we can get people connected to treatment, even if they're youth, teenagers, whomever it might be, the curve on getting well improves. So yes, we look for any of those opportunities to get the word
You guys
out.
partner
the
up
news
with
out.
a lot of
yes, community
different stuff. So I want to switch gears a little bit because both of us have a unique skill set, and my partner here, she's CIT trained. Can you guys talk about that?
Sure. That is one of the most exciting opportunities we've had. We are very thankful to the department at the state level for allocating funding through the Diversion Council to provide CIT, Crisis Intervention Team training, for officers throughout Oakland County. We've been able to take those dollars. I believe right now we've trained about 99 officers, many from the Sheriff's Department and from communities all over Oakland County. And it really brings the wealth of experience and at least that kind of in the street knowledge of recognizing individuals that may be having a crisis, and equipping officers then with some of those skills to respond to individuals and get them to care in a safe and healthy way. What was your experience?
I did take that training, and it's funny because you're like, oh, I have a 5-day training course. Like, all right, I'll go to it.
Yeah.
But I'll be honest with you, it was really good training, and I believe our department is trying to put all of us through every time it comes out. They're trying to get as many people through as possible. I think 5 went through it with me. But it's a lot of information. It really teaches you how to talk to people in a different way than and this is for everyday people, not just for law enforcement.
Sure.
But of course, we are in a position where we deal with a lot of people, and it really teaches you what to recognize, how to speak to them, triggers, what you want to stay from. So, I thought it was a great experience.
Did you have a chance? Oh, I'm sorry. Did you have a chance to do the training on juveniles as well?
I just
or
found
did
out that you guys
Okay, the
offered it,
youth?
and it was after
Okay.
someone had said, hey, why aren't you in the class? I'm like, I didn't know they offered it. But one of our officers, I don't know if it's just one, or was it just one?
I think Sergeant St. Germain may have went through
Okay.
juvenile. Officer Miller, Joseph Miller, he's going to be one of our guests on an upcoming show. He's trained that way also. Our department, Chief Patton, is really progressive when it comes to making us aware, because truth be told, it cuts down on a lot of unfortunate events when officers have this training. we can recognize things. Through my own experience as a crime prevention specialist, I get various training also, and it makes me aware when I'm interacting with somebody, there's certain characteristics that I may observe, and I know Z is trained on it also, that you may observe that may prevent me from taking this individual. I'm always on my guard because that's what we have to do as officers.
Sure.
But I may view, without the training, I may view someone as being aggressive towards me when in point of fact they're not being aggressive at all. It's just me being able to recognize it,
Right.
and knowing what I'm looking at. So our department, I know Chief Patton is mandating every officer within our agency be
That's
CIT
wonderful.
trained.
That's great.
You know, we also get, so we frequently get calls to, you know, attempt suicide, or they're thinking about it, or a friend's called for them. And that class honestly has helped even with dealing with, you know, those people, you know, the persons that are having a hard time, and, you know, how to speak with them, how to really get them to, you know, I want to say calm down or bring them down a little bit so that we can either get them to common ground or to the facility or either to Henry Ford Hospital.
And what I think is really nice about the CIT training is it is classroom work, but the doing the role playing
Yes.
and the simulated events really helps officers.
I would agree.
I've seen that.
Because you're really putting into action what you guys have just talked to us about, and it's really nice to be able to practice it. So yeah.
And there
I would
are
agree.
many trainings that are available. I know the state is also really pressing around mental health first aid. But the difference between that and the CIT is that element. It's that
Yeah.
role playing, it's being in that whole group of other officers who have the same life experience
Right.
on the road as you do. And
Now you guys
got great
offer
feedback.
something else, some other training that I've been a part of for train to trainer. Can you talk about that?
Sure, I think you're referring to our LEARN program. That's Law Enforcement Responds with Naloxone. Some people know Naloxone as Narcan, which is a
Right.
trademark name.
That's what I noticed.
Right, and most officers
Yes.
do. We started that in response to the opiate crisis we have in the United States, and Oakland County certainly is also experiencing many issues with opiate overdoses as well. And the thing that we try to impress upon officers and help them understand is that not only is this a person who's overdosing, but it's someone's son or daughter, mother,
It's somebody's
father.
loved one.
Right.
Absolutely.
And so you saving that person is helping far more than just that person. And families are very grateful for that. The one thing we also like to do with that program is equip officers with little cards, because we wanted something that's easy for officers to carry, not something big and cumbersome when they are carrying their naloxone kits. And that on the card says, for free or low-cost substance use services, call this number. And it has our 24-hour crisis line on the back of it as well. Because if a save is made, we really want to equip the officers with a solution to give the person. Please engage in treatment. And we are actually seeing the fruits of your labor. People are coming into our access
Are you guys
center.
tracking that?
That's amazing.
Tracking that number?
We track every save that's done in Oakland County
Okay.
and the demographics. So we can kind of look at if there's a certain area or anything we need to do to beef up our services related to it. And people are coming into our access center and saying, you know, I was overdosing,
Wow.
an officer helped me, they gave me this card.
I've been on several scenes with our West Bloomfield Fire Department. They're amazing. I'm biased, but and they've got multiple saves with it. So it's an
amazing
outstanding tool for us to have. We have them on board in all of our patrol vehicles, and believe you me, as being an officer here for 21 years, I'm thankful for you guys giving us that training, because now I'm able to pass the training on to civilians as well as other officers.
Well, one thing that's going to complement that actually is a new service that we have created in our opening, and we actually have Common Ground as the selected provider. It makes the most sense because they run the crisis center as well. And so what we are opening, some people refer to it as called social detox or an engagement center. And this is really to help our law enforcement and our hospital partners when someone is presenting at the hospital, or you come across someone who's really struggling with a substance use disorder.
Okay.
You rather divert them from placing them in jail for the night or
Right.
things of that nature, and you'll be able to 24/7 just like you do with the crisis center, bring them in.
Oh, okay.
And we will take them and keep them until we're able to secure a bed for treatment.
Wow, okay,
And
and that's
so-
at the same facility.
It's at the same facility,
Wow.
and we're hoping to open it late spring, early
Wow.
summer.
Are you guys going to do a soft opening, as they say,
Oh,
or
absolutely.
it's going to be televised, or so everybody will know in the county?
We will certainly, first and foremost, reach out to our law enforcement partners and our hospitals. Really, the most important, because individuals who are withdrawing from substances can potentially have some, adverse effects to that. And so we have to partner with our hospitals so they know. They can send people to us, but we may have to send people to them if the symptoms are too severe and they may need some medical intervention.
Now, guys, we got just a couple minutes left. You guys, between the two of you, wow, the amount of experience you guys both have, but each just give us a quick bite here in terms of resources that are available, if you could, and then we're going to close up the show.
Certainly. What I do want to make sure is that the community has the access number to the crisis line. Common Ground has operated that line for a very long time, and they're really good at what they do. That number is 1-800-231-1127. There's also available text and chat. So for young people, young adults, or for anyone really, having the chance to text anonymously and silently has been a tremendous asset as well. So that number, or you can look at the commongroundhelps.com, I believe it is, and look at their services there as well as looking at our website, which then gives you the bigger picture of all the services that we're able to provide.
So we have a large amount of contracted providers, especially for Oakland County, outpatient services. And we have residential services as well, but you have to come through access. It's a higher level of care. You have to meet certain criteria. But what's important, I think, for the county to understand is that if you're feeling that your substance use is really affecting your life, you can go into any one of our contracted providers. You don't need to go through access first. They will provide the clinical assessment and seek authorization through us. It's really just direct service. If someone needs a higher level of care, we will assist with that as well. I think I just want to bring it back for my last thing is to the prevention services, because it's completely open to the county. And a lot are within the schools. I talked about ACHC. Another great resource is Students Leading Students. They're in a lot of our Oakland County high schools. It's a peer-led program focusing on peer leaders and refusal of the use of substances.
That's pretty awesome.
All of our providers are listed very clearly on our website for people to access. And again, that's www.occmha.org.
Well, you guys, again, Zena and I both were excited to get you guys on because we knew you'd have so much valuable information for the community. Thank you guys both for coming.
Thank
Okay.
you.
Thank you.
Thank you.
Folks, that's going to do it for another exciting episode of West Bloomfield 911. My name is David McNealy, and this is my partner.
Zena Dailey.
That's going to do it for us again, folks. You can follow us on Twitter. You can like us on Facebook. You can also find us on civiccentertv.com. And for the most up-to-date information, public safety related, you can hit us up at nixle.com. Thanks for watching. Bye-bye now.